Good morning. I'm Matt Zabolotny with ZMark Health, and I wanted to take a minute and share with you some of the changes that we are foreseeing as it relates to Medicaid eligibility. Many of our customers here at ZMark are Medicaid providers, and the changes that we see forthcoming later this year and early in 2027 are important for you to keep an eye on if you serve uh, Medicaid eligible consumers or patients. So last summer, July of 2025, there was a piece of legislation that was passed at the federal level called the One Big Beautiful Bill. I'm certain most everybody's heard of it. It will introduce some significant changes to Medicaid eligibility that I think everybody in this space really needs to be aware of and keeping an eye on. So a couple of the highlights I'll just share with you real quick. Um, there's a work requirement now that's being enacted. So uh, Medicaid eligible individuals who are of a certain age and able-bodied must work a certain number of hours per month, and states will need to ensure that that's occurring. And if that is not occurring, these folks will lose their Medicaid eligibility. The law ends some immigrant status qualifications. So that will also move people off of the Medicaid rolls based on their immigration status. So again, something to keep an eye on. And finally, another big piece here is the redeterminations and how frequently those occur. They're moving it to 6 months instead of the normal 12. Now, again, some states have a little bit different requirements than others on how that goes. But this is sort of changing in real time as we're going along here. There's some states that are already starting to enact some of these changes at their level prior to them being put into place at the federal government. So again, most of these changes are coming late 2026, early 2027. One other thing I'll add too is that in the many decades that I've been doing this, oftentimes these changes are put forth in some type of legislation, and then they tend to get maybe watered down or changed. Again, this is an election year, 2026, so if things change at the federal level, there may be more changes coming to this. So, the most important thing is just to keep an eye on it, check into some of the rules and changes that are occurring, do that frequently. And we will, of course, continue to provide information on this to our customers and others. So a couple of things that you need to think about as a Medicaid provider, some things to put in place and maybe some aspects of your business to tighten up. But you want to understand and document your current verification workflows. We hear many times from providers that, well, they have someone who verifies eligibility and they're supposed to do it frequently, but we're not sure how often they're doing it. You want to make sure you're fully aware of that. And if someone on your team is responsible for doing this, you want to document and train and support that person to make sure they're doing it in the frequency with which they need to, which is at least once a month, to make sure you're tracking this. You want to build in processes that are ensuring frequent verification, as I noted, and really ongoing verification. So it's great to check it for sure when you have a new consumer that's coming into care, but you also want to continue to check it consistently, especially with these new rules that are coming into place. A consistent frequency of checking is going to make sure you're in tune with consumers that may be losing eligibility and, of course, gaining eligibility. Looking at claim denials that are related to eligibility is a great way to sort of understand if your process upstream is working or not. That should be fairly easy to do, just to see what claims are denying, why, when you do the investigation, what's the root cause, and you can fix that and better tune up your processes as a result. You want a scenario plan for volume and revenue volatility. Uh, Volume meaning the frequency with which checks are occurring. The revenue volatility means that you may have to consider that if you're not tuning things up with your eligibility, your business may be losing some money as a result of trying to bill for services for Medicaid members that are no longer eligible. So you want to check that. And there's a lot of tools out there that will help automate this process for you. There's a lot of them. We don't particularly recommend any specific vendor, just as a nature of our firm. But if you want to have a conversation with me about that, I'd be happy to talk you through some of the options that are out there, some of the things that we see, and of course some of the tools we're using to conduct our business. We can help you with that as well. So again, we'll continue to put out some information on this in the coming months as things evolve with this. But again, definitely something to keep an eye on. And it's a perfect opportunity for you to ensure that your processes are working, that the tools you have in place are doing what you need them to do, and that you're maximizing your reimbursement. So again, thank you for your time. And if you have any questions, you can certainly reach me on LinkedIn or through our website. So thanks and have a great day.